Okay, Chad, today I'm with Derek again, and we're going to do inspection of the abdomen. This is my third clinical checkoff. Okay, first thing I'm going to do is going to look at the contour. I'm going to get above just eye level. Okay, he's nice and even. Okay, flat. Don't have any fat there. Now I've got this light shined lengthways. He is symmetric on both sides. That looks good. His umbilicus is where it's supposed to be. He's got a mini. Okay, now I'm going to look and see if I see any pulsation or movement. I can see his respirations because he is nice and lean. Okay, now I'm going to see, right here is about the epigastric. Let's see area in the aorta, see if we can see anything there. Oh, I see his normal respirations. Okay, are you comfortable? Not nervous? Good. Okay, thank you very much. Okay, now next I'm going to listen to Derek's bowel sounds and listen to his aorta down here and his renal and iliac arteries, okay? He's got active bowel sounds. I'm going to go clockwise position. He's got such a long thorax, it's a little bit longer than normal patients because he's so tall. Okay, where they're hypoactive in the lower quadrants. Now I'm going to listen to his aortic. I do not hear any bruits, but that's common because he's only 25 years old and I'm sure he has no peripheral vascular disease, hopefully. Okay, thank you. I'm going to percuss Derek's 4 quadrants, okay? There should be a timpani sound. Okay, then I'm going to measure his liver span, okay? I'm going to go down to the 5th intercostal space. Okay, right there. Alright. Okay. A normal one is 6 to 12 centimeters. Where he is so long, he is right at 10. Okay. That's good. Okay. Now, I'm going to go to your right upper quadrant and percuss your spleen. I'm going to go to the lead clavicular line, and I hear timpani there. Okay? Alright. Alright, now I'm going to have you sit up for a minute here. Okay? Now, I'm not going to hurt you. Turn around here. It's going to feel kind of funny here. But I'm going to put my hand over your 12th rib, okay? Alright? And then I'm going to thump you. Okay, thank you. This is our favorite part, okay? We're going to palpate all quadrants. We're going to do light and deep palpation, okay? So light. Okay, now Derek, this is going to be a little bit firmer, okay? Let's see if we're feeling for any masses. The good thing about Derek is, where he is a nice lean specimen, and he's not obese, that we can pretty much see that we don't have to palpate very hard because, or we don't have to palpate very deep. We can see that he's nice and firm. And there's no masses or anything like that. Okay, now I'm going to palpate for his liver, and his spleen, and his kidneys. Palpate his aorta. Okay, now I'm going to do the fluid wave, and what that is doing is that's checking for ascites in him, okay? Derek, if I could have you take your hand, put it in your midline, okay? Okay, thank you. Okay, Alright, next we're going to assess the cranial nerves. Okay, we're going to do the second one, which is the vision. We did the eye test last check-off. We know we checked his vision, and we know that he does wear glasses and he has some visual problems there. We're also going to check the third, fourth, and the sixth cranial nerves, and that is the oculomotor nerve, the trochlear nerve, and the abducens nerve. Okay, and what those does is the oculomotor, that tests eye movement. Okay, can you take your glasses off for me for just a second? Okay, can you shut your eyes open up? There you go, good. And it also, for pupil constriction, okay? We don't have a lot with this, but we did that last time. We know what that, how to do that. The trochlear does the downward and the upward movement of the eye. You might want to leave your glasses off for a minute. Look up, look down, look side to side. Good, okay. And then the sixth one, that is the abducens, and that one does the facial, the lateral movement of the eye from side to side like we did before. Good, good. Okay. Now, the next one we're going to do is the fifth, that's the trigeminal, all right? And that one's the one chewing. So show me how you, like, open your mouth, shut it, like you were going to chew. Can you chew? Mastication? Good, good, good. Okay, then we're going to go to the eighth, okay? Can you hear me okay? Because I talk pretty loud. Okay, we did the hearing test the last time, so we know that he can hear that one too, all right? The glossopharyngeal one is the swallowing and the talking, and we know that he can talk and he can swallow. And the 11th is the spinal, okay? And that's his movement. Let me see you move your arms out, down. This one, up, out, and down. Good. Okay. And then your last one is, let me see your, stick your tongue out for me. All right, stick it up. Stick it down. Good. All right, thank you, Derek. Okay, now we're going to do the motor system, and we're going to assess a couple things. His motor sense, his strength, and his tone, okay? So we can look and see. He's got good muscle tone. Okay. Now, Derek, I want you to do a shin test, okay? It's called a heel to shin test, and what you will do, you'll pick your leg up at an angle, and you will run that down from your knee all the way down, from your shin all the way down to your foot, okay? Good. I need to do that on the other side. Good, okay. And again, I'm going to palpate his legs. They're all good and solid, muscle, okay? I'm going to have you sit up now, okay? And put this in. Now, I need you to stand up. You're not dizzy or anything, are you? Okay. I'm going to have you walk. I'm going to assess your gait. This room is kind of short, so I want you to walk up. And then I want you to walk back. And can you do that for me one more time, please? Good. Okay. Now, I need you to stand right there like you are. Okay, this is called the Romberg test. And what I need you to do is to keep your arms down to your side, okay? And stand nice and straight with your spine erect like you are. And close your eyes. Okay, I'm going to ask you to do that for about 20 seconds, okay? Okay, we're 20 seconds into this. Now, are you dizzy or anything? Good. Okay, now you can open your eyes, okay? Now I'm going to have you do the drunk test, as I call it. It's walking heel to toe, okay? I know you've never done that before. So I want you to take one foot in front of the other, okay? Okay, good. Now turn around. Now do it. Can you look straight ahead and do it? Okay. Now walk towards me. Now can you walk on your toes? Good, like a duck. That's good. Now, I want you to walk back on your heels this time, okay? Okay, now turn around and face me. Now I want you to do some shallow knee bends, okay, with your back erect. 3 of them, please. Thank you. Okay. Now, the next thing I'm going to have you do is called a rapid alternating movement test, okay? We kind of went over that before, so if you'll come over here and say it, I know you know what I need you to do, okay? Put your hands on your palms and go to town. Okay, look up at me. Dizzy? Pain?
Nope.
Okay. All right. The next thing I need you to do, that's a good job, Derek. The next thing that I need you to do is the finger-to-finger test, okay? So I'm going to have you stand in front of me. Okay? Now, Derek, we're going to do the finger-to-finger test, okay? I want you to place your finger on your nose, and then wherever I put my finger at, I want you to reach over and touch my finger, okay? Good. Now what I want you to do is, I want you to close your eyes, okay? And I want you to take your right hand and touch your tip of your nose. Good. Now take your left hand and touch the tip of your nose. Good. Do it one more time. Right hand, then left hand. Good. Okay. And that completes our motor system. Thank you very much. Alright, now we're going to do sensory function. The first on the list is sensory pain, is superficial pain. Derek said I heard him last time when I did the fluid wave test, but can you feel this?
Mm-hmm.
Okay, good. Good. Alright, now I'm going to do tactile discrimination. It's fine touch. Where's my hand at?
Left side. Right side. Middle. 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 Neck.
Good. Okay, the next I'm going to do is vibration, okay? And the way that we're going to do that is with a tuning fork, but I don't have one, so we just won't do that one, I guess. Alright, the kinesthesia, okay, it's position sense, okay. Alright, give me your hand. I want you to close your eyes, okay? Now, tell me which way I'm doing your extremities.
Up. Down. Right. Left. Up.
With this hand.
Left. Up. Down. Right.
Okay, good. Okay. The next thing that we're going to do is, it's called stereogenesis, okay? And I'm going to give you a few objects, and I want you to keep your eyes closed, and I want you to tell me what you're feeling, okay? Close your hand. What are we feeling there?
It's a cone.
Good. What do you got there?
It's a cylinder.
Okay, good. What do we have here?
A cloth of some sort.
Good. And then lastly, what do we have here? Put your hands up and down if you need to.
I think it's a ruler.
Oh, good job. Okay, keep your eyes closed, okay? The next thing we're going to do is called graphesthesia, okay? Now, I'm going to take your hand and I'm going to trace either a number or a letter, okay? And I want you to tell me if you can see which one it is, okay? That is a number, so which one is that one?
1.
Okay. That's a letter.
A.
Good. Now what's that? I'm not going to tell you.
A D.
Good. Alright, good job. Next we're going to do the 2-point discrimination, okay? And this tests the person's ability to distinguish the separate sensations on 2 different sides, okay? Alright, so I'm going to take these pepper clips, okay? I'm going to start right here, back of the arm. Tell me when you feel both of them or none of them.
Both.
Is the sensation the same?
Now they are.
Okay, now I'm going to try the back of your leg here. Getting worse?
Yeah.
Okay, alright, good. Alright, the next thing we're going to do is extension, okay? And that's when I'm going to touch both sides of your body at the same point, alright? And I want you to tell me if they feel equally bilaterally the same. You know, like, does that feel about the same?
Mm-hmm.
Okay. Does that feel the same?
Mm-hmm.
Okay. Squeeze my hands. Good. Okay. Same? Same? Same. Let me see your legs. You feel the same?
Mm-hmm.
Same? Same?
Yes.
Okay, good. All right, thank you, Derek. That's good. That's all for that one. Derek, we're going to do our bilateral reflexes, our deep tenon reflexes, okay? All right. And we are going to start with our biceps, okay? Good. I'm going to do this arm. Good. Now we're going to do our triceps, okay? Good. This arm. Good. The next thing we're going to do is the brachiodalis, okay? And we're going to do that right here. Good. Good. All right. And the patellar, okay? Good. Good. All right. Now I'm going to have you lay back in a supine position, okay? We're going to do our Achilles. Now we're going to do the Achilles reflex, okay? I'm going to start down here. Good. Good. Now we're going to cross it. Good. Okay, now we're going to do the clonus test. And the clonus test is testing for reflexes when they're hyperactive, okay? I do not feel clonus. The abdominal superficial touch, okay? Reflex. Good. 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 Okay. Now we're going to check for the plantar reflex, okay? Bend your leg for me. Good. Good. Now that concludes our... Now we're going to do the muscular skeletal system, okay? And we're going to start with his joints. We're going to start with the temporomandibular joint, okay? That's at the tragus area. All right. Can you open and shut? Good. One more time. Open and shut. Good. We're going to do that right at the tragus area, okay? We're going to look at his cervical spine, okay? And there's 7 cervical areas right here. Don't feel any knots. Okay, good. Okay, I'm going to look at your shoulders. They're good, symmetrical, even. Okay. I'm going to look at your elbows here. Bend them in and out. In and out. That's good. I'm going to put this elbow over here. Good. Okay. I'm going to look at his wrists. Did that hurt, Derek?
Mm-mm.
Good. Okay, and then we'll look at your hands. I'm going to go ahead and look at each joint, okay? Palpate each joint. Okay. The next thing I'm going to ask you to do is called a Phalen's test, okay? I want you to place your hands like this, okay? Like that. All right. Look straight ahead. We're going to do that for approximately 90 seconds. Okay, 90 seconds later, are you having any pain or dizziness? Good, okay. The next thing we're going to do is the Tinel's test sign, okay? And I'm going to take take his median nerve here and percuss it. Okay. Good. Good. All right, good. Okay. Now, I want to look at your hips. Can you stand up here for me, Derek? Okay. Now, Derek's good and tall and lean. Got good hips. Okay. Here. Can you bend side to side? Good. Bend here. Good. Bend forward. Bend backwards. All right. Good. Okay. The next thing I'm going to have you do is lay down here on the table for me, please. And we're going to look for the bulge sign, okay? And what that is looking for is fluid around your knee area, okay? Okay, go ahead and lay that one down. Good, no fluid there. All right. The next thing that we're going to look for will be the McMurray's test, and that is testing for meniscal tears, okay? Lay there, hold your knee in, breathe it in for me. Now, let's see. I'm going to look at your ankle and your foot down here. Okay. I'm going to palpate these joints. Look at your toes. Okay. This ankle. Good range of motion with that. Good. All right. Now, the last thing we're going to do with that is we are going to look at your spine. Set up here for just a second. Going to look at it. It's good and even. Okay, all of his vertebrae look good and even. Okay, the last thing I want to look at. Alright, the next thing we're going to do is a little legs test, and we're going to make sure that there's no pain in his legs. See if there is. We're going to raise this leg. Any pain, Derek?
No.
Good. Okay, good job. Now, the next thing that we're going to do after that is we're going to look at your skin color and your joints. Your feet are a little cold. Do they stay cold?
Yeah.
All your joints were good. We assessed those earlier. Okay. Sit up here and we're going to palpate. Your favorite thing. I'm going to start here. I'm going to palpate the shoulders. Palpate the muscles. All the way down. Palpate the bones. Go over here. He's got good muscle tone. Look down here, all his joints and stuff. Okay. And then we're going to do some range of motion. Okay. All right. Let's see. We're going to do some flexion, abduction, adduction. Okay. All right. Now, Derek, we're going to do a muscle testing. Okay. And I'm going to have you put your arm supine on this table. Okay. I'm put my arm here and my hand here. I want you to use your hand and flex up towards your wrist. Good. One more time. Good. Okay, now we're going to do some exercises, okay? We're going to do some abduction, adduction, flexion, okay? So the first thing I want you to do is bring your arms out, side to side. Bring them into you. Bring them up. Bring them back down. Bring them side to side. Good. Now, I want you to move your, like that, yeah, there you go. Laterally, go to the other side. All right. Now, can you bring your arms and bring them all the way into your back? Okay, turn back around. Yes. There you go. Good. Now I want you to flexion. Okay, good job. Okay, now I'm going to have you lay on the table and we're going to do your legs, okay? Alright, bring your legs up, down, up, down. Bring them into you. Good. Into you. Now, can you bring them to the side? Good. This side. And then bring them up at the same time. And bring them into you at the same time. Good. Okay, and I'll have you sit up. Okay. I think that concludes our third checkoff. Thank you very much, Derek. Appreciate it.